Hello, my name is Destiny Rodriguez. I'm going to be presenting my PowerPoint today over the definition of nursing by Virginia Henderson. Our theorist, known as the First Lady of Nursing, was born in Kansas City, Missouri on November 30th, 1897. She got her diploma in nursing from the U.S. Army School of Nursing in Washington, D.C. in 1921. She then later completed her BS in 1932 and her MA in 1934 at Columbia University. Now, she didn't get her name just from being a nurse. No. Virginia Henderson was also an educator, researcher, and author. She was the author of the 1939 4th edition revision of Bertha Harmer's textbook of Principles and Practices of Nursing when the original author died. She was also co-author for the 5th edition in 1955 and the 6th edition in 1978, as well as a book called Nursing Research, a Survey of Assessments written with Leo Simmons and more. In 1953, she became a research associate at Yale University of Nursing, then transitioning to emeritus status in 1971. Not only that, she was also a full-time nurse instructor in Virginia in 1924 and also a professor at Teachers College in Columbia University from 1934 to 1948. Now, what was her theory? Or I guess we can just say her definition, right? She introduced her definition in her 5th edition of the Principles and Practice of Nursing textbook. She defined nursing as assisting the individual, sick or well, in the performance of those activities contributing to health or its recovery, that an individual will perform unaided if he had the necessary strength, will, or knowledge. She believed that nursing involved assisting the client in gaining independence as rapidly as possible and assisting him or her achieve peaceful death if recovery is no longer possible. Not only that, if we were to get more in depth of what she meant by nursing, she also identifies the 14 basic fundamental needs of nursing care. That includes checking that the patient is breathing normally, eating and drinking adequately, eliminating body waste, moving and maintaining desirable positions, sleeping and resting, selecting sustainable clothes, maintaining body temperature within normal range, keeping the body clean and well-groomed, avoiding dangers in the environment, communicating with others, worshiping according to one's faith, working in a way that one feels a sense of accomplishment, playing and participating in various forms of recreation, and learning, discovering, and satisfying the curiosity that leads to normal development and health, and using available health facilities. All those are some that Henderson truly believed in is what a nurse, not obligated, but what her role is as a nurse. Now, as you can see in these photos, I included 2 pictures, both showing a nurse aiding another person. One is taking blood pressure out of a patient, and the other is also helping a patient move around. It kind of goes back to what she was saying, not necessarily that nursing is just taking blood pressure and doing stuff like that. It's also making sure that you help them in activities that they can no longer be able to help themselves with, and making sure they have a full recovery if needed. If they can't have a full recovery, that you're there at every step of the way helping them. Now, what are the benefits of this definition or theory of nursing? In Henderson's defense, the definition is used as a clear understanding of the nurse's role that can be used in nursing education, practice, and research. It also promotes patient independency by encouraging nurses to support patients in doing what they cannot do for themselves. It also provides a clean framework for nursing assessments and care planning using the 14 basic human needs that I had already previously explained. Although Henderson has very good and valid points and does explain what a nurse is, there is some limitations to her definition and theory of nursing. It lacks in-depth guidance for complex emotional and psychological issues. It also has weak guidance on nurse-patient interactions, as well as limited guidance on the dying process. Henderson's thing was more about caring for their patients when they can't care for themselves, how to do it, and stuff like that. But it doesn't explain how to interact with a patient, how to create a bond, how to, if they're going through something, how to emotionally be there for them and stuff like that. So there is some limitations. Although her definition is very good, there is some limitations to it. When applying the theory and, well, I guess definition to nursing care to patients, Henderson's definition of nursing provides an understanding of what nurses' role and duty should be towards their patient. Her definition encourages and assists patients in regaining the ability to care for themselves. Her 14 components of basic nursing care serve as a guideline to nurses on what they must do to help a patient. Not necessarily that that's all they must do, but if on her belief of that they must care for the patient until, since they can no longer do it for themselves until recovery or until they're fully recovered, she provides some 14 components of basic nursing care that help the nurse care for that patient. Now, my view of nursing practice related to my theory, well, I keep saying theory, my definition is that I first off want to say I am very impressed with Henderson's accomplishment and what she has done while she was alive. You know, she is someone that in some nursing schools, it's a required textbook, you know. Her definitions are in there, her knowledge is in there, you know, as well as she has also not just accomplishment of like the book. She was a teacher. She educated people too. She received awards and all of that. So, yeah, I was very impressed with her. But I truly do believe that nursing is about supporting individuals to regain control over their health with tasks they can do. It's something that I have done all my life by helping like my family members with their health conditions. Growing up, we've had people with diabetes like me, breast cancer, colon cancer, liver failure, pancreatic failure. And, well, since I grew up a lot with my grandparents, they have breast cancer, and one has breast cancer and the other one has severe diabetes. I was always there to give them their pills, make sure they're taking on time, checking my grandma's blood pressure at such a young age, helping them move around. If they wanted to get up sometimes and they just felt too tired, I would help them, I would walk them. If they were hungry and just didn't have the strength to cook or wanted something that they liked, I was there to help them. And anything, if they can't pick their clothes, if they couldn't wash their clothes, I was there all the time helping each one of them. So yes, I do believe in Henderson's definition of nursing. I think it's one thing that is making me be a nurse, is that I want to be there for a person who can't be there to take care of themselves, with the obviously hopes that they can recover. Another thing is that her belief is something that I stood at even before the project, like as I stated before, my family. But now, after researching her, my view only got stronger with a backbone to go back on. When I become a nurse, I will stand by with what Henderson believes in and use her 14 components in my advantage when caring for a patient that can't care for themselves. And then in my last slide is all my references. Most of these books are Henderson's. Well, they are Henderson's books. The first one is more, she's a co-writer, and then the other two are more, it's hers. But yes, these are the books I reference in. Thank you so much for listening to me, and I hope y'all have a wonderful day. God bless.